Hi, my name's Andrew Lewandowski and I'm a pediatrician in Wisconsin. I'm making this video because many people don't know that climate change affects human health. One way that I see this in my clinic is through increases in insect-borne diseases. This reminds me of one of my patients, an 11-year-old boy who had meningitis caused by Lyme disease. He started to get better with IV antibiotics, but when we tried to send him home on a 2-week course of oral medication, he couldn't keep it down no matter what we tried. As a result, he had to come back to the hospital so that he could have a semi-permanent IV placed into his arm so that a nurse could give him IV antibiotics from home. He did eventually get better, but altogether his care required 2 urgent care visits, an ER visit, admission to the hospital, a week of vomiting, sedation for an invasive procedure, and a month of IV antibiotics, not to mention his family's medical bill. These stories, like the boy I just mentioned, are becoming more frequent as a result of climate change. We are seeing increases in tick and mosquito-borne illnesses, and air pollution alone caused over 64,000 premature deaths in the United States in 2016. Worsening air quality and increases in insect-borne diseases are only 2 out of 8 ways that climate change is harming human health, disproportionately hurting children, pregnant women and their unborn children, rural populations, and communities of color. We failed to prevent climate change, but for now, climate change can still likely be reversed if we support our local, state, and federal policymakers as they work to make the necessary changes to clean up our energy grid. If we don't act now, then harms from climate change to future generations of children will soon be irreversible. So, on behalf of my patients, on behalf of my family, and on behalf of the people you love, please support our government leaders as they work to tackle this unprecedented problem. We can't wait anymore.